इसको एक दफ़ा क्लिक करें स्क्रीन में, हाइड इसको दबाना, हाइड आप अपना वो चला लें, प्रेजेंटेशन रिकॉर्डिंग हो रही है।
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم بسم الله مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. Now I have already given the dyslipidemia made easy to you to understand the disturbance of the lipid metabolism. I say that there are risk factors. I have told you about it. Hyperlipidemias, rather terminology is misnomer. The dyslipidemia terminology is acceptable, or rather, the lipoproteins terminologies are more acceptable and logical because triglycerides, cholesterol, and phospholipids are lipoproteins, and these are there are disturbances of these lipoproteins, which is called, which will be the most important risk factor, metabolic risk factor for the atherosclerosis is concerned. So I have already told you about the classification and other things, and I say that important thing is most important factor in lipid profile, that is called fasting lipid profile, is total cholesterol HDL ratio. It should be less than 3.5. If it is more than 3.5 and you are increasing it to 4 to 5, means there are more chances of developing the ischemic heart disease or atherosclerosis. The more is the HDL, more least are the chances of the atherosclerosis. More are the triglycerides, less will be the HDL. It is inversely proportional and is very important point regarding the HDL is concerned. So HDL for the male in Pakistan should be at least 35. Now for female it is at least 40. So it is satisfactory levels, although the acceptable levels and the favorable levels are more than that. For the males it should be 40 and the female it is 50, ideal levels. Classification has been done and the physical features have already been explained. The primary and secondary lipidemias has been the dyslipidemias has been explained. Now the guidelines has been explained about it. And treatment strategies, we are starting with the treatment strategy. First one is the lifestyle modifications. That is got the highest role in the management of the hyper or dyslipidemias or dyslipidemias. Second option is lipolytic agents. And third are in advancement now there are other treatment of modalities. Difficult cases are there because the genetic conditions. I have actually classified previously according to the American Heart Association these lipidemias, dyslipidemias as isolated hypercholesterolemia, isolated triglyceridemia, and third one is the what is called as mixed type of the dyslipidemia, and the fourth one is low HDL levels, only low HDL levels. So the classification of the American Heart Association is concerned, and there are four types, easy one, rather than Fredrickson classification, which is difficult to remember because you have to know everything about it. The apolipoproteins and the metabolism and other things. You can't remember all the things. So lifestyle modification, lipolytic agents and other modalities, new advances, recent advances. Lifestyle modifications are the one of the most important thing is the exercise and weight reduction, alcohol abstinence, and quit the smoking. Although it is difficult for a person to do it, exercise can be done easily at the home by cycle, static cycle, or on the treadmill. But it's better to move outside in a park. If you are younger than 40 years of age, you can go for the jogging. If you are still younger than 20 years, between 20 to 30 years, you can go for a running. Even running is allowed. But if you are more than 50 years of age, only brisk walking is allowed. If you are more than 70 years of age, slow walking is allowed, not brisk walking. So this is a very important point regarding these factors as concerned about it. And the thing which I want to see is about this epidemias as concerned. The, the physical exercises, physical activity needed by you people are, I have already given. At least, according to the American Heart Association and WHO, is 1 kilometer per day at least. But I recommend 2 kilometers per day. A total of 14 kilometers per week without any absences. Absences should not be there, right? So it means that you have to go for these treatment, lifestyle modification are concerned. I say already mentioned out that the exercise is very important part of lifestyle modifications. Some people are fond of joining the clubs, the gym clubs. Okay, fine, no problem. You can go for in the gymnasium where the instructor will tell you how to do it, and it will lead to the weight reduction definitely. The target is to reduce the weight also. If you are overweight, it means that BMI is between 27 to 30. You have to reduce the BMI to 26. If you have got simple obesity, means that BMI is more than 30 to 35 between it. You have to reduce from 35 to 32, for example. Weight reduction in 3 to 6 months is definitely needed. Alcohol abstinence, it is a difficult task. Although it is a difficult task, but the psychiatrists can do this. Department of Psychiatry, they have their role in the management of the alcohol abstinence is concerned. Quit smoking is also their part. I have done many times this to quit lectures on quit smoking, how to quit smoking, but this is not the time to do it. Smoking is concerned. Quit smoking. I'm not telling about the other things. In Pakistan, they are also the gutka and what is it called as mawa, prags, etc. These type of things, and vaping is also practiced. They are also are definitely a risk factors. You have to quit these vaping or gutkas or mawa, etc. You should stop it. Second part are the dietary restrictions. Go for the DASH diet, that the DASH diet means that dietary approaches to reduce or to stop hypertension, DASH. Diet, now that its principle is this that there are certain foods which are absolutely should not be entertained in the diet. Abundant foods there. Now, what about them now is concerned are the ghee or butter and the banaspati ghee and the even the derivatives of what is called balai or malai of the things. These are the problematical, and they have got high caloric value, and they will definitely increase the neutral fats in the body, which will be converted ultimately into the triglycerides. And then, of course, LDL cholesterol will be higher, and there will be problems. And you should not eat the beef if you want to take only once in a month. As the lamb is concerned, once in a week only. Promote the chicken and fishes or lean muttons. And if you want to eat the animal sources, use these once or twice or thrice. You know, so everybody is not the meat lover. Everybody is not. The principle of actually of this dash diet is this is TLC diet, total, you know, it's a low caloric diet, and it is need, how much nutrient is needed are saturated fats less than 70%, and polysaturated fat up to 10% of the total calories, monosaturated fats up to 20% of the total fat. It means that 25 to 30%. Otherwise, 50% to 60% are carbohydrates. Fibers are 20 to 30 grams. So balanced diet should be needed. Cholesterol should be less than, like, 150 milligram is needed per day. Reduce it to less than 200 milligram total cholesterol. ये टेक की बात कर रहे हैं, ये सीरम कोलेस्ट्रॉल की बात नहीं कर रहे हैं। तो एक वन एग में जो योग होता है उसके अंदर जो होता है वो होता है 200 मिलीग्राम, 200 मिलीग्राम 250 मिलीग्राम कोलेस्ट्रॉल होता है। तो एग ट्वाइस अ वीक आप ले सकते हैं, फुल और वाइट ऑफ द एग डेली यू कैन टेक। नाउ ब्रेकफास्ट शुड बी फिक्स्ड हियर, ब्रेकफास्ट को फिक्स करें। द मेन डाइट नाउ the lunch is the lunch and the dinner. So the lunch or a dinner in our country is the same. The principle is that make 3 plates. One plate is only of the fruits, every fruit. Whether you are diabetic, you will no problem. 30% of your appetite. First plate is 30% of your appetite, and it should consist only the fruits of every type. The second plate is also 30% of your appetite. Make your own plate, it means that 30% of the second plate is of the salad plate, green salads. It means you got fruits and avocados, what is called as, and these type of things, the kheeras and cucumbers, etc. The salad leaves and the icebergs, etc. It should be 30% of your appetite. The third plate is what is cooked in the house. For example, roti or chapati or bread or whatever it is. Try to avoid the items from the bakery or try to avoid from the sweet shops. Try to avoid them because they are making these items with the butter. And butter has got high energy and it will increase the fats in the body. You should not eat. Try to avoid it. So it means 30%. First plate is 30%. First take the fruit first and get rid of it. The second plate 30%. salad plate, get rid of it, and the 40% is the of your appetite should consist of what is cooked in the house. It may be just like yeah, for example, the you can say roti or a rice or pulses or the vegetable, whatever you like. Try to avoid fast foods and the junk foods. It's not included. It should be abundant. It should be forbidden. It should be. So this is called dash diet. Plan the dash diet for that patient. Take your time and explain him Indian menu or Pakistani menu. And there are lipolytic agents, bile acid binding resins, and nicotinic acid, and ezetimibe, and HMG co-reductase inhibitors, and fabric acid derivatives. These are the pharmacological intervention. If the LDL cholesterol is higher, 130 to more onwards, and triglycerides are higher than 150, for example, more than 200, 250, 350, or the ratio of the total cholesterol to HDL is higher, for example, is more than 5, you have to use the lipolytic agents. Depending what variant of the lipid is actually is raised now. Find out the, the bile acid binding resins, nicotinic acid, ezetimibe, HMG co-reductase inhibitors, and fabric acid derivatives. These are the tools in the as a pharmacology or pharmacotherapy are concerned. Bile sequestrants are they convert cholesterol to the bile acids, bind bile acid and prevent the resorption in the gut. They increase triglyceride level. They may increase, in the as a reaction. Most common side effects are GI constipation and alternative to statins we are using here. Colostipol, for example, is a very good bile acid sequestrant. There are other agents are available, but we are not using it. Normally because of the side effects. Patients do not tolerate these type of agents. But they are good agents. If the patient can tolerate, they are good agents. They are meant for the cholesterol, not for the triglycerides. Second, my agent was nicotinic acid niacin. Now, it reduces the production and release of the LDL cholesterol. Effective also in the reduction of triglycerides. It increases the HDL. That is a very important part of the nicotinic acid. Very effective in increasing the LDL particle size, means that LDL of many types, low density or intermediate density, etc., chylomicrons, the size are increasing. So if the size of the LDL is lower down to HDL, it is better. The conversion of HDL is from the LDL now. But you have to monitor the liver enzymes and the glucose because these are the side effects. Actually, hepatic dysfunction is the most important part of the side effects here of the nicotinic acid or niacin, which is actually a vitamin at some time. And the other side effect is flushing. Flushing actually is the problem with the nicotinic acid. And you can use ibuprofen 30 minutes prior and take with light snack. It will reduce flushing on the face, redness of the face, and sweating on the face. it means that these are the good agents, definitely good agents. There's no doubt about it. So, nicotinic acid at one time was the drug of choice in 1974-75. So, try to remember the nicotinic acid or niacin. That is why our teachers they were using in 1975-76 these agents. The other agent we are using is ezetimibe. The mechanism of ezetimibe is Zatia, it's available as Zitia or Izita or Jazita combinations, etc. That impair the dietary and the biliary cholesterol absorption at the brush border of the intestine. Actually, it acts on the brush border of the intestine without affecting the triglyceride or fat soluble vitamins. It's possibly the Niemann-Pick C1-like protein involved in the cholesterol transport. It, and that is why the cholesterol is excreted out in the feces. LDL cholesterol decreases by 15 to 20%, and there are about, in some studies, they said they increase HDL 5%, triglyceride levels reduction 10%. In some studies, reveal that they are effective in reducing the triglycerides as well. But it is actually meant for basically for the LDL cholesterol. It may be added to the statins, that is HMG co-reductase inhibitors. So indications are avoiding if you are using statins and you are using higher dose of statins, which will cause problems to the patient, then you can add this as ezetimibe. It's a very good drug. Only side effects seen are the adoption and the gas production, and because it will also act on the succus entericus lipase, and increased gas production is the problem in some patients. And this is the actually the mainstay of the management of the LDL cholesterol. That is HMB-CoA, hydroxy, hydromethoxy, glutaryl, CoA enzyme reductase inhibitors. The mode of action is that the malonic acid is the byproducts of the neutral fats in the beta oxidation. Malonic acid will actually afterwards it will converge in there is a conversion of the malonic acid to the other uh, particles. One is LDL cholesterol. If you block the enzyme, the HMB co-reductase inhibit, it means the HMB co will not be converted into the malonic acid or malonate. So malonate will not. If there is no malonate, there is no cholesterol. This is the mode of action. So this is difficult to remember. If it is difficult to remember, that's all right. Partially block an enzyme is necessary for the formation of cholesterol. Speedy removal of the LDL, very fast acting drugs. First generation, second generation, third generation drugs are developed. There are about 18 to 60% reduction in the LDL. And liver enzymes are the problem. Must be monitored 3 monthly or about 6 monthly. You have to monitor the enzymes. So lipid lowering agents are very helpful as HMG coretic inhibitors. And then I switch on to another important aspects that somebody has got the higher, triglyceride level, but normal cholesterol levels. The, if you reduce the triglyceride, the HDL will rise. It is inversely proportional. I have said already. Reduce the triglyceride level as lower as possible. So this will help in the management is concerned. The agents we use here are the gamfibrozil and fenofibrate. Fenofibrate is more tolerable substance. Where it is, the triglyceride levels are more than 300 milligram, for example, you will use 200 milligram capsule. Otherwise, if the triglyceride levels are between 200 to 300, you use 67 milligram. If it is resistant with the fenofibrate, you use the gamfibrozil in addition to the fenofibrate. 600 milligram gamfibrozil twice a day is effective agent because it will rise the ideal level to 11%, reduce the triglyceride level. Only problem with these agents are these side effects: gallstone formation, dyspepsia, and diarrhea, nausea, vomiting. And Lipolytic is already said about myalgias. So the adverse drug reaction are seen with the gamfibrozil, specifically speaking, the myopathy. It will cause myopathy, and reduction reduces the efficacy of warfarin, somebody on the warfarin, by 30%. So this is the lipid lowering agent as fibric acid derivatives or fibrates are concerned. Now the agents which I have said already are the HMG coredoxase inhibitors. It is written first generation, second generation, third generation. Lovastatin was the first generation agent. It's a very, very good drug. Problem is myopathy. Second generation drug is atorvastatin. Second generation. It can be used at 10 milligram to 80 milligram depending upon other agents which are not freely available, although now available is fluvastatin and pravastatin. Rather, rosuvastatin is the most commonly using drug nowadays. 5 milligram, 10 milligram, 20 milligram to 40 milligram, depending upon the condition you have. At one time, we were using simvastatin, which is the agent of the first generation. Very powerful agent, Zocor. The first generation simvastatin and lovastatin, the second generation is atorvastatin, and the third generation are fluvastatin or rosuvastatin or pravastatin. These are the agents we are using, 10 milligram to 80 milligram. Simple as that. Other treatment modalities are available. Lipolytic is a drug, new drug, which will act on the liver enzymes and it will enhance the beta oxidation process and getting lower cholesterol levels with the lipolytic as well as triglycerides. Very high levels of the triglycerides or LDL cholesterol, there you go for the plasmapheresis or gene therapy. Even surgery is necessary, it has been done to reduce the belly fat or the other parts of the fats. They have done what the mesenteric fats are removed as much as you can, liposuctions and other strategies. And new drug options are there, like for example, more fibers in the diet, carrots, grapefruits, avocados. I already said the beans, garlic, onion oil, omega-3 fish oils are very important adjuvant therapy with the as far as triglycerides are concerned. Horizon, because the new advances are the glabridine, leucorized root. They are now under the study. It's very good, study is going on the glabridine. Not available now. And another study is going on the lecithin cholesterol acetyl transferase, because an enzyme is bound to HDL, acts as a powerful antioxidant. They are antioxidant as well as vitamin E is also antioxidant. Thyroid hormones have been they are also using it assists in the weight loss. And those person who can tolerate the thyroid hormones, they are not recommended agents. The good news is that they say that a small amount of the caffeine is helpful. Means coffee, small amount, two or three, four sips, 3 or 4 times a day are helpful in the reduction of the LDL cholesterol. HDL cholesterol can rise also, and tea, green tea as an antioxidant, fruit juices, vegetable juices, they decrease the atherosclerotic disease. Now, the last part of my lecture today is how to increase the HDL level. First one, if you have higher level of triglyceride, reduce the triglyceride level because they are inversely proportional to the HDL. Recommended HDL for the male should be 35 to 40, and for the female is 40 to 50. So do you reduce the triglyceride levels, go for the aerobic exercises, they are a good one. Aerobic, quit smoking, reduce your weight, avoid alcoholism or smoking, cut off trans fatty acids, which are used in the bakery items and in the sweet shop items, increase the monounsaturated fats, which are present in the fishes, in the chickens, and add soluble fibers in diet, vegetables, fruits, they are the natural fibers, cranberry juice, fish oils, and calcium. They said the calcium supplementation, vitamin D supplementation are also helpful to increase the HDL levels. This is the research which I have done previously. I'm very thankful that you have listened to this discussion. I hope that you can manage the cases of the dyslipidemias. Number one, by counseling. Number two, going after counseling, the calculation of the risk factors. Go for the lifestyle modifications. If the LDL cholesterol is there, the first drug of choice is the HMG co-reductase inhibitors. If it is higher more than that, you add the ezetimibe agents. If only the triglyceride levels are higher, go for the fibric acid derivatives. Try to practice like that. If you talk with the patient half an hour about management plan, they will definitely cooperate. I was at one time 100% successful in management of the dyslipidemias because mostly they are related to the genetics rather than the acquired diseases. So I am very thankful to you that you have listened this talk, and inshallah ta'ala we will meet it again at sometime inshallah, no problem. Allah Hafiz.